Disc replacement may be considered when nerve or spinal cord symptoms appear. These symptoms must match what doctors see on MRI scans. Scans show disc wear and extra bone growth. They help doctors see pressure on nerves. Planning includes confirming the target neck level and facet joint health. It also includes selecting an implant design that matches the anatomy. Scans show disc wear and extra bone growth. Two-level disc replacement is only approved in selected cases and devices. Through a small front-of-neck opening, the surgeon removes the worn disc and any pressure sources. An artificial disc is then placed to maintain space and support motion. Restoring disc height can increase space for nearby nerve roots. The goal of disc replacement is both nerve relief and motion preservation. Many patients begin gentle movement soon after surgery. Hospital stay is often short, depending on symptoms and recovery. Early outcomes often include fast relief of arm pain caused by a pinched nerve. Doctors monitor healing and implant position during follow-up visits. Disc replacement may put less stress on the discs above and below the surgery level than fusion does, especially in carefully selected patients. Cervical disc replacement remains a key motion-preserving option that has changed how surgeons rebuild the cervical spine.